Well, it's just a huge honor for me today to be podcast interviewing two legends and mentors of mine, Dr. William Cliff and his niece,
Assistant niece.
who's worked with him for 20 years. That
That's
is
right.
so cool. Family first. You said it was your brother's daughter?
It's my wife's sister's daughter.
Oh, so she's an outlaw.
Yeah.
Here, I thought you were a perfect in-law.
Yeah.
We claim her as an
And you're a crazy outlaw. And William Cliff here is a practicing endodontist with over 28 years of experience and the founder and CEO of Asesso Health. Throughout his career, he recognized a major gap in how TMJ and bruxism are diagnosed and treated, leading him to develop an integrated data-driven solution that combines a custom appliance with real-time tracking technology. His work focuses on improving patient outcomes by bringing clarity, comfort, and measurable results to treatment of jaw pain, grinding, and sleep-related concerns. And before we have this discussion, I just want to get it off my chest that I've been addicted to Dental Town since 1998, and it seems like take pediatric dentists. I only know one controversy they have, and it's over silver diamine fluoride, and that's been out for 10 years, and they kind of have worked that out. I don't really know of any controversy with endodontists. I mean, it's not like half the endodontists want you to use Thermophil and Sargenti, and the other half don't. I'm not really aware of any polarizing deals. I can say that with almost all specialties until you get to TMJ. I don't want to offend you because I know that's where your whole heart, mind, and soul is, but there are so many different camps and they fight like cats and dogs. And it's like, I don't want to go negative Nelly, but do you agree or disagree that is the most controversial?
No. I totally do. In fact, thank you very much for that introduction. Kudos to you for starting Dental Town. Very grateful for the opportunity to be here. So yeah, thanks a lot. I want to talk a little bit about functional dentistry, specifically TMD, and how it kind of impacted, the trajectory and the story behind what I do on a daily basis. And, I just kind of randomly fell into it because I was in a spot. And so I kind of have to give you a little bit of backdrop to kind of tell you how I actually got here. And so, GPs refer their patients over to get a root canal. And invariably, something else was going on. And so, unfortunately, in dental school, you only get 2 to maybe 10 hours of formal TMD training. So you don't really know a whole lot. Today, it's still underdiagnosed, misdiagnosed, or not diagnosed at all. And so I kind of found out in 2003, I really needed to educate myself. Luckily for me, a good mentor and friend of mine is an orthodontist, and I know he wrote his master's thesis on TMD. So I said, Mike, you got to tell me everything that I need to know about TMD, because I think a lot of people are coming into me for root canals, and I get paid for doing root canals, but I don't want to do the root canal if the root canal doesn't need to be done. So,
Oh, you're not one of those guys with ethics, are you? Really?
so anyway, I know it's kind of sickening, but anyway, so at that time, I decided that I was going to do a comprehensive TMD evaluation on every patient that came in. And so a lot of times I just didn't feel like doing the root canal was appropriate. I would send them back to their GP to make them the orthotic, and invariably they'd end up coming back to me 6 months, a year later, and the cases that I see, we've all seen those images of like root canal, extraction, implant, apicoectomy, and you're kind of mortified, like, what's going on here? Like, are their teeth that bad? Well, maybe they are. Maybe they all needed it, or maybe there's something else going on. And so I would send the patients back to the GPs. They'd make the orthotic. They'd invariably come back to me a year later, and I would say, did you get the orthotic? Yeah, I made it, but compliancy is a big issue, because a lot of times they'll wear these big acrylic night guards that they just don't want to wear, and invariably they take them and they throw them in their bed stand, never to be seen again. And so I really wanted to have some intention around what it was that, a comprehensive solution to not only to be able to treat it, but also be able to monitor it as well. Fast forward, I was giving a lecture to about, 20 of my endodontic colleague friends. on TMD, and they all kind of seem to be missing the point as well. And so, 2016, I decided I really got to do something about this. In the meantime, back to 2003 again, or somewhere around there, 2010, I started making my own night guards for patients. And I'm there to help my patients. I'm not there to get them out of pain. And so even though it was a little bit of a conflict of interest between the GPs and me, because that's not my job, but still, I have the best interests of my patients at hand, and I want to get them out of pain. So I started making my own orthotics. And initially I started making the same orthotics that everybody else was making, Gladwell Lab, Microdental Lab. So I went down to Microdental Lab. I said, I want you to make the orthotic this way. So in fact, they called it the Dr. Cliff Splint at Microdental Lab, which is a big lab.
That's a huge lab.
Yeah.
That lady, what's that lady's name that runs that?
I don't know who runs that, but yeah, Microdental Lab is a big lab.
I met her at LVI.
Yeah.
But anyway, she's a legend.
They do great work there, fantastic work. But so they started making the Cliff Dental Splint for me, and patients were like loving it. I mean, so much so that they needed to get another one. And kind of the secret sauce behind this whole thing.
I'm just taking notes. I'm not texting my.
Yeah, that's fine. You do what you got to do, Howard.
What is it called? The Clifford.
That's called the Cliff Dental Guard.
The Cliff Dental Guard.
Yeah.
And Microdental makes it.
They don't make it anymore. We make our own.
Okay.
So, Asesso Health.
And Courtney's over there saying, "Who made it?"
Yeah,
I'm pretty sure I made it, not you.
Yeah. So invariably, my patients were starting to love it. It was taking care of all their comorbidity issues that they were having, the frequent headaches, the migraines, the nefarious sinus-like infections, the jaw soreness, tinnitus, and markedly poor sleep. So when I said I needed to do something about this, I started to formulate a team together in 2019. And, with all the new technology, I needed somebody else that could actually help me with this. So my co-founder, Abhijit Lemay, came over from Amazon. He brought on the Amazon Alexa. And so we've all heard of the Alexa before. And so he product engineer, but he's also a vision engineer as well, especially when it's related to camera. We'll get into that discussion in a little bit here. But we started Asesso Health. Officially started R&Ding, raising money to R&D, and to where we had a comprehensive solution. And this comprehensive solution comes in this nice little case right here that has these pretty little UV disinfectant lights here. If I can show this, this is the case it comes in. Yeah, we have 2 night guards. We have the capability of 2 night guards. This is a consumer grade night guard that you can just boil and bite. It has a patent slope design, and we could talk about the freeway space or the equilibrium space of the night guard. So we want to mimic the natural opening of the jaw, because that's when the muscles of mastication are in the relaxed state.
I'm sorry. What does the light indicator and the lid do?
Yeah, we'll talk about
You'll
that
talk
in
about
just a
okay.
second. Yeah. That's the Fitbit. That's your our sensor that basically will gather all of the metrics.
Man, and this has got AI in it too, right?
It does. It has machine learning core in there. It knows the positions, because what we want to do is we want to rule out the false positives. Yeah, we'll talk about that in just a second. So, but I wanted to be really intentional about having a comprehensive solution. I didn't want to give patients just a plastic, acrylic night guard in a plastic little case and send them on their way. I wanted to be able to monitor and actually get feedback on if it's actually helping their pain points, if they're integrating, if they're using it. It was funny. I listened to a podcast of yours with Priya Mystery.
Yes.
And it was awesome. And the work that she's doing is incredible.
She's in Portland, Oregon, not too far from you.
Yeah, but she attacks it in a little bit of a different way, which is great. I think it's fantastic. She's helping her patients, because this is kind of a hot topic, because, like I said, it's not being really addressed at all, or it's being misdiagnosed or underdiagnosed. And so at Asesso, we just come from a little bit of a more simplistic approach. And that approach is this. Once upon a time, somebody got hit in the face. They fell down at a playground when they were 5, 6 years old, got hit with a soccer ball, did MMA, like yourself, once or twice or 1,000 times, snowboarding, bicycle accident, car accident, you name it. When you get hit in the face, that little articular disc inside your temporomandibular joint is super fine. And what happens is if it forms with any type of fibrous connective tissue or loses its synovial fluid inside it, what happens is the muscles of mastication actually connect to that little articular disc, and that little disc heals in a poor way. And the jaw is the only bisymmetrical joint in the body, and it wants symmetry and harmony. And so in the middle of the night, when people are sleeping, the muscles of mastication, the masseter muscle, the temporalis muscle, the pterygoid muscles, are contracting, trying to put that little disc in its rightful spot because it wants harmony with the other side. It's never going to recapture it. And that's why people grind. And 75% of everybody that I see on a daily basis, they come in, you see it all the time, they have flat lower anteriors. How did they get those flat lower anteriors? Did somebody take a file or a burr? Maybe if they wanted super flat teeth, but most of it is just because of their grinding. So when I do a comprehensive TMD evaluation, I always take the pad of my finger, rub it on the superior head of the masseter muscle, and I can literally bring a tear to their eyes. And Courtney knows, because Courtney's a TMD sufferer. I can actually look at Courtney's face in the morning time, because she's worked for me for 20 years, and tell if she wore the night guard the night before or not. That's how
Really?
impactful it is.
Yeah, I get a lot of pain, a lot of
And
headaches.
she's a kid too,
I
so
don't
she's
know.
not the most compliant. So I see her, I'm like, oh, you didn't wear your night guard again last night. So anyway, so we have 2 night guards. We have our consumer grade night guard that we call our G series. Has a
G series?
G series for grind series.
Oh, okay.
Yeah. And it has a patented slope design on there, and it mimics the natural freeway space opening of the mouth.
And just in case there's a kid in dental school, which a lot of our viewers, explain the freeway space.
Yeah, so the freeway space is the equilibrium space between
Is the what?
or equilibrium space. It's basically gravity pulling down on the jaw, and the jaw, it becomes very static, if you will. It's its most natural opening, which is probably about 4 millimeters from tip of the incisor to tip of the incisor. So what we did is we modeled the actual opening of the jaw and placed the grind guard in the same proximity of the natural opening. So it wasn't contracting at all, which is great, right? Because we want to mimic not only the grinding forces, but more importantly, we want to minimize the clenching forces, because clenching forces is probably 10x what grinding is. If you grind your teeth all night long, it's one thing, but if you're clenching, it's like doing squats with like 500 pounds compared to doing, squats with 10 pounds, the difference between grinding and clenching. So we wanted to basically, minimize that. It has a hard slope on it. It has to be hard because, we have this little brain center in our head called the mesencephalic ganglion that basically tells you stop biting down, like biting down on a rock or a chicken bone tells you to stop biting down, as opposed to having a consumer rubber night guard that mimics like chewing gum. It actually exacerbates the problem and makes the problem worse. So we have night guards. We're able to make a custom night guard, which we call our Atlas Series 2, which you can take an impression. You can send us the impression. We have a manufacturing facility that will make you the custom night guard, or we have some really exciting technology where you're able to capture the STL file over an iPhone. And it gets to within 100 microns, which is fantastic. But we can make a custom orthotic just by doing that. And we'll talk a little bit more.
Well, just
about
one
that.
saying, you went from the G series, went grind, to the Atlas series. The Atlas, you're talking about the,
Custom night guard.
but what is, where'd the name Atlas come from?
Yeah, we just named it Atlas because it's
I was thinking of the vertebrae.
No,
the Atlas.
no. We just named it Atlas. Yeah.
Okay.
So our G series guard, which is more consumer grade. But the beautiful thing about the G series guard is when what happens is we're trying to get this in the hands of dentists, okay? Because we want to have the dentists become resellers of this product and basically be able to fit it and give it to their patient that day. They don't have to wait for the lab to come back 4 weeks later, because what was happening with me is I was seeing patients and I would say, they're in excruciating pain, they're getting frequent headaches, they're getting poor sleep. They want this thing today, and I have to say, well, you have to wait 5 weeks for the lab to deliver it back. So I wanted something in the hands of dentists to be able to actually fit their patients that day. The difference between the Atlas Guard and the G Series Guard is the Atlas Guard is just a little bit smaller and a little bit more comfortable to wear. This is super comfortable to wear as well. They both do the same thing. They both take care of the TMD.
Can you tell by looking at it if it's the Atlas Guard or the G Guard?
Oh yeah. Actually,
Which one's that? The G? That's the G Guard.
Yeah, this is the G Series Guard. Yeah. We just brought the G Series Guard.
Okay.
The Atlas Guard. Is available right now, by the way. I did not bring it.
And when you say, okay,
it looks a lot like the acrylic guards that you would get from Glidewell, except it's my own design.
AsessoHealth.com, is that where they buy your?
They can go to AsessoHealth.com. Yeah.
AsessoHealth.com and they can buy these?
Yes.
Okay.
So we have a dental portal.
I mean, do you sell them on Amazon too?
No.
Okay,
No, we
so.
do not. So they can go to the dental portal, they can sign up, they can order.
And what's the dental
solution.
portal? Oh, because it's
It's for
consumer.
dentists. Yeah, they'll put in their
Oh, I
license
see the
number
dental
and they'll
portal.
basically
I
just
see.
go in there and order up the complete solution, or they can buy the individual guards too if they want and just sell those to their patients. It makes no difference to us. I will tell you that I'm probably selling about 20 to 25 of these complete solutions a month.
Wow.
So, I mean, and patients are actually starving for it. They've never really asked.
Thank you, Jerry.
Most people, thank you. Most people don't go and do any comprehensive, TMD evaluation. And another reason why is they don't actually ask the right questions. So if I see they have flat teeth, after I'm done giving the anesthetic, what I'll do is I'll actually ask the patient, hey, by the way, I've noticed that you have flat teeth. Do you suffer from any frequent headaches or migraines or poor sleep? And they look at me like they've never been asked that question before. And they look at me like, you're my hero. Are you going to fix this for me? So it's not a hard sale on my point. Patients are actually starving for this. Now, I only see 7 to 8 patients a day, and I'm selling 20 to 25 of these a month. Can you imagine it getting in the hands of dentists that actually see an awful lot of patients? I mean, patients are actually starving for this. So
The reason that is it keeps track of their patients for them. So most we have them, what we're having to do for our current dentist is they're putting in their office phone number without the area code, just to make it easy for the assistants and staff to remember when they're telling their patients what that reference number is. And the reason that is because it keeps track of the dentist patients. So the dentist can actually look at their patients' data. They could see their metrics. They could see if they're being compliant. They can see their grind scores, all of that sort of information on their doctor portal. So that dental reference number makes it so.
Because
their
when they wear
patients
that,
have
it's going to talk to their
their
smartphone,
app. Yep. Mhm.
and that'll talk to the app,
That's correct.
and then you get to see that.
And you get to see all of
But
that.
but we already learned from flossing the essay. Yeah, I floss every day.
Yeah.
You know they're lying,
Yeah.
but
So
this one is light
now
proof.
we have, actionable.
yeah, so listen, you can imagine first responders how important sleep is. You can imagine professional athletes or geeks like me that like to wear their whoops or their Aura rings or their Apple Watches to see steps.
That's what your ring is.
No, it's not my ring. I
But
wear
what
the
is your?
Whoop.
Is that a wedding ring or is that?
This is a wedding ring. Yeah,
It's not a biomechanic thing.
No.
Because there's some biomechanic rings that look just
Yeah,
like
I
that.
tried wearing them. I couldn't do it because my gloves, my hands,
Yeah.
it just didn't work out real well for me. So, but yeah, we wanted to be intentional about giving great data back to our patients. So not only measurable data, because your Apple Watch or your Fitbit or your Aura Ring or your Whoop, whatever that is, it just gives you measurable. It doesn't actually tell you, hey, you need to drink more water and go pour water down your mouth. So we have the guard to treat the symptoms for it. But we wanted to give, very actionable and measurable results back, very thoughtful. So we've shown that, by wearing the night guard and people that have interact with this little sensor here, this little sensor basically gets taped to the side of the masseter muscle at night. This is your Fitbit or your Apple Watch, okay? And basically it captures all the movements, and we eliminate all of the movements you get up to in the middle of the night to go walk, to go to the bathroom, or you sat up because you couldn't sleep and you started to read. It removes all the false positives so that we can just capture the measurable movements while you're sleeping of the masseter muscle contractions. So we've been showing.
Does it also measure their sleep apnea and all that stuff, or just training?
Not sleep apnea, but sleep
Hygiene? Or
efficiency is what we like to call
sleep
it.
efficiency.
So so it will measure, reduction in awake time. It'll measure toss and turn events, like did you have a restless night sleeping? And it tells you also, are you getting more or less restorative sleep? So when people are grinding, you can imagine they're grinding 1,500 times a night, okay?
Say it's 1,500 times. That's a back and forth one time.
Back and forth, just grinding.
Just back and forth one time is a lap.
Yes, is a lap, but also clenching. Clenching is like this. You can see that masseter muscle popping out this way, right? So clenching is actually worse because that fatigues the muscle even more. There's just more strain from the masseter muscle and the temporalis and the medial pterygoid that are, causing that strain. So we've shown through our cohorts, we have about 250 people that are integrating with the sensor right now. We've been showing that the grinding is being decreased by about 78%. The muscle fatigue is being reduced by about 76%. The sleep efficiency or restorative sleep is actually going up by about 82%. Toss and turn events are going down by about 50%. And the awake times during the middle of the night is being, the improvement is about 33%. So we're showing real measurable improvements. But a dentist can prescribe this right now. So like I said, yes, can prescribe it right now because it's only EVA material.
And how much does it cost?
Material. So what we do is we sell the complete solution to the dentist for $228, which basically mitigates the cost of what the lab fees would cost you. Your assistant time's in there taking an alginate impression, your time out diagnosing it. And we wanted to give it to the dentist because inherently they have tremendous value. They have value in doing the examination on the patient, telling them why they have TMD and what's going on exactly. And so your time is very valuable. And to be able to, give them an orthotic that same day is super impactful. So I wanted the dentist to be able to charge whatever it is they want to charge, whatever their value is. And I don't know what everybody's value is. They can charge $228 or they can charge $600 or $700. I don't know. That's not for me to determine, So
well, if you want 50% overhead, you charge 5 times lab bill. And if you want 65% overhead, you charge 4 times lab bill. And at 3 times lab bill, now you're basically a volunteer and create jobs. And I hope you feel good about it. But so you charge the dentist $220, so they should charge $1,000. It should be $999.
They can charge whatever it is.
And the other thing that's really weird with humans, it's so counterintuitive. When you give someone something free, they don't value it. Like kids. Oh, yeah. If I bought my boys the bicycle, they'd always leave it on the front yard. So I started making them pay for half of their bicycle, and then they kept the bike in their bedroom. And so a patient, I think a patient that pays $999 for this device will take it as serious as their iPhone.
Yeah.
And someone who gets it for free from an insurance clinic, in fact, if you want a retainer, where you can get a free retainer? Just go to Denny's because everybody takes it out, puts it in their napkin. And the box of the box in the back of Denny's got about 100 retainers in it.
Again, we wanted to be super intentional. We wanted to have something comprehensive. This is just not a night guard. It gives back great metrics. We wanted to create tremendous value with this. We wanted to have UV disinfectant lights in here. Once you rinse off your night guard, you put it in there. The UV disinfectant lights come on for 3 minutes. And so we have the measurable results. Now, I got to tell you, what the post-processing on the back end to get the metrics here to go onto your dashboard on a morning basis is pretty incredible. I mean, right. you're in the AI space, so you understand what's going on, and we have AI embedded inside our little sensor as well to be able to do all the machine learning for all the positions and the actual grinding. And I'm not going to get into the algorithm that actually breaks down the difference between grinding and snoring. I mean, because it's a fine line. So that really has to be expanded, and you can kind of see that in the detail. But we wanted to give real solid measurable results. Even your Fitbit or your Apple Watch, if you walk, the confidence level of your Apple Watch, just say you wanted to measure your steps. Well, you wear it on your right arm and you get 12,000 steps, and you wear it on your left arm and you get 10,000 steps. You're like, who's telling the truth? Is it the left arm or is it the right arm?
So why are the arms different?
Well, because there's only about a 65% confidence level on your measurable results that you get from all of these things. That's just how it is. Fitbit, Apple Watch, they're not 100%. And so we're actually really we're at about the 70% confidence level, but we'd really like to get to about the 90% confidence level to really break this down on
every time I put a Fitbit on, it just automatically dials 911 for an ambulance. It says, "Are you dead?"
Yeah. So anyway, this is our solution. If you wanted to make the custom night guard right now, the app, what we call our Atlas, right now you can take an alginate impression. We'll also send you the alginate impressions, basically, and you can send it back to him. We have a FDA certified lab that actually makes the orthotic for us. But like I said, when the scanning capability comes out, if you have a scanner, you can just scan it in your office, 10-second scan. If you have a printer, you can just send your STL file over to your printer as well. So that's.
Do any scanners? I mean, those are Bitcoin. Any scanners you like working with, and any scanners you don't really like working with?
So we've just compared our scanning technology to the scanners that are already in the market, and the scaling proportion is exact. So again,
So you send a scanner, or they use their own scanner?
It'll probably be a licensing agreement. So you just download the app. Every time you take a scan, we'll charge you a certain percentage.
And you're planning on they take the scan with their iPhone?
That's right.
Can it be Android smartphone, or need it be iPhone?
We've enabled it only for the iOS. For the iPhone right now, we are currently working on Android.
I can tell you some side information about that from
Sure.
Dentaltown.
Yeah.
250,000 users.
Yeah.
Dentists love Apple.
Yeah.
I mean, to say it's 80-20 is an understatement. It might be 85 to 15.
You bring that up, but what's really what I found kind of shocking is in the market, Apple is only about 55% in the US, and Android is the other 45%. But I'm going to just go with your dentist like iPhone's better.
Well, dentists are upper class.
Yeah.
Anywhere around the world, they're always in the top
Good
10% income,
Yeah, I hadn't thought about that.
and they're always in the top 4% in years of education, 4 or 3%.
Yeah.
So even if you go to a developing country, well, the dentist ain't developing country. He's got an iPhone and a Mercedes Benz, 9 times out of 10. I mean, they do. They're just,
Right.
they love, they're higher income. They're Target, not Walmart.
Yeah.
Target, I meant.
Yeah.
They're Target, totally Target, not Walmart.
Yeah. So, we just got to the point where we started selling.
But can
these.
I hate to interrupt, but
No.
you and I are old dogs.
Yeah, river dogs.
Yeah, you got grandkids?
Not yet.
Not yet?
No.
I got 8 grandkids. I'm obviously older than this guy, and you're like, yeah, we can tell by the video, Howard. You have a face for video still. I have a face for radio. But the reason I do this so much is because I get all these emails and DMs from the dental students and the under 30 crowd.
Mhm.
They're not happy, and they're all whatever. That's a whole nother episode. But the thing is, they're working with someone they love and respect, their mom or their dad. That's about 1 out of 5, and the rest are all working for a DSO. And this whole TMJ deal is just a screen like, well, do you clench or grind, or I see where facets? Okay, you need a guard. So they're going to call in their Courtney, and she's going to come in and take alginates. They're going to send it to a lab. They're going to make a night guard, and they're going to send it back. And then the assistant, a lot of times you got an expanded function, is going to check the bite, and then you're going to come in, check it with a mirror, and check the bite, and then they're done. That's. I'm sorry to say this, but I believe that's probably 9 out of 10 TMJ cases in America. Do you agree or disagree?
100%.
Okay, now I want you to tell that dental student, not a dental student, first 5 years out of school, she's working for a big DSO. She's working for her dad, her mentor.
Yeah.
That's what he does.
Yeah. Yeah.
Hey, tell her what's right or wrong with that system, because that is TMJ. And by the way, I mean, that is, and I got a follow-up question before that. The dentists call it TMD and endodontics.
Yeah.
The consumers call it TMJ and root canals. I mean, don't they not? I mean,
they call it TMJ, which is a temporomandibular joint.
Yeah. So I noticed you went with the TMD. So like, is it offensive when you as an endodontist hears a lady say, "Yeah, you did a root canal on my tooth"? I mean, so where do you put TMJ and root canals versus TMD and endodontics in communicating with patients?
I don't think I'm following you fully, Aaron.
Yeah.
Well, if you say TMD,
Yeah.
I know America,
Yeah.
80% of them are know what you're talking about.
Yeah.
You say TMJ,
Well,
oh yeah, my mama had that.
Well, when I
And if you say you need a root canal, but if you say you need endodontics, they're like, I'm a man. How would I have endometriosis? I mean, no.
Right.
Well,
You know
it's
what I mean?
funny. No, when I talk to patients, I usually use TMJ because
Okay,
everyone's
that's what I was saying.
Everyone's kind of familiar with TMJ because they've heard somebody's told them they have TMJ.
And as an
you know.
endodontist, do you say root canal or endodontic therapy?
Yeah. I just say root canal.
Yeah.
They
Okay.
can associate
Yeah.
with that a heck of a
Yeah.
lot.
So do you think from a marketing point of view?
So listen, 75% of everybody that walks in my office has TMD. About 15% have really acute symptoms, pain, facial pain, ear ringing, migraines or headaches, and super poor sleep. You can imagine if you're getting a full head workout in the middle of the night, you consistently stay in light sleep. And those people don't sleep real well because they're waking up because they're getting a full head workout. You're releasing endorphins, all the good stuff of the autonomic nervous system, so they don't get, so we're on a crusade for them to get more measurable deep sleep and REM sleep. And so that's where we want them to be. That's where we want them to play. So for the most part, dentists have actually been addressing teeth. They've been addressing teeth, and they don't correlate the symptoms with that because, sometimes we become a little narrow focused. And so you see the wear cassettes being worn down, they grind their teeth. It would be incumbent on them to ask the thoughtful questions. Do you suffer from these comorbidity symptoms, the headaches, the nefarious sinus-like infections? My co-founder basically went and had $120,000 sinus surgery to fix the sinus because he was getting the headaches and he was feeling like he had sinus pain, only to find out that it didn't work at all. We made him a nice orthotic and he's been symptom-free ever since. So my problem is, and the problem that I have is it's being underdiagnosed, misdiagnosed, or not treated at all. 75% of everybody that walks through my door has TMD. 75%.
And do you think that's for all 4,000 endodontists in the United States? Do you think they probably
I
have
think that's for probably 5.5 billion people in this world.
out of 8 billion?
They fall down once or twice. They've got hit in the jaw. I mean, brotherly love, wrestling. I don't care. Snowboarding, wakeboarding. I mean, how many times have you fallen down or been hit in the face? 1,000 times? 1,000,000 times?
Yeah.
So when I listen to your podcast, with Dr. Mystery, right? She has a pathognathic physiology, side of things where, the jaw's not growing right or, tongue tied or this and that. And I don't think that's wrong at all. I just think we've just approached it in a little bit of
Well, what would you say
way.
to the kids in dental school? Because what would you say are the major TMJ camps or TMD camps? I mean, LVI Dickerson has one. Pankey has one. How would you name the camps? Like, what are the big camps called? Neural.
Yeah, I don't know. I haven't really ventured into that space just yet. I just know this from treating my patients for the past 15, 20 years. And the results, Courtney coming back. But I also wanted to measure those results. So we have pop-up notification before you open the dashboard. How'd you sleep last night?
I'm going to give you the same
headaches,
advice I gave Ben Johnson on Thermofill.
Sure.
You remember Thermofill?
Sure, of course.
And I was hearing about that, and I called him up. He was such a great guy, and he goes, he was in Oklahoma, or Tulsa. Tulsa, I said, And I was born and raised in Kansas, and I was talking to him, and I said, I just wish I could see it. He goes, where are you? And I said, I'm in Phoenix. He goes, dude, Southwest Air and flies direct. He goes, it's like probably cost you $250. Jump on an airplane, fly down here, and I'll pick you up at the airport. And I spent the day with him. And this was before I was a lecturer, magazine. This is just out of the bottom of his heart. He didn't know me from Adam, and there was nothing to know. And I went down there, and he was showing it to me, and I told him, I said, hey, buddy, look. He says, I said, I know a little bit about business, but when you sell this, I'd put all your effort on the instructions. Because I literally was so confused. I flew down here, and so that girl I was telling you, she works for her dad. Her whole TMJ department is that one thing, and that's the end of it. You need to make an online CE course on Dental Town that hits the nitty gritty.
I love that.
And it doesn't matter. And if it's they'll only watch it for an hour.
Yeah.
But if you need 2 or 3 hours, you need to make a 3-part series because that's the TMJ department for what percent of dental offices in the United States is at the end of it. Alginets, get an implanter, seed it, bite a couple times, we're done.
The beauty of this is that
Courtney hasn't got to speak yet.
Oh no, that's what I was gonna
Go
say.
ahead.
No, I was gonna say the really great thing about our G series is that's the same day solution. So there's no alginate, there's no waiting, there's none of that. The doctor fits this, or doctor assistant, I fit them all the time at his office. Same day, and they go home with it.
Go ahead and tell them how you do it.
Yeah. So, so you boiling water, you drop this in, sits in there for about 15, 20 seconds. The ends start to come together. It shrinks up a bit. You take it out immediately, go fit it on the bicuspids side by side, have them bite down. It's a done deal. It is a literal, I think it takes longer to boil the water than it does to fit the patient. So it is so fast and efficient for the doctors. It's fast and efficient for the patient.
So they get that for $228.
The doctor gets this. It comes all included. This
For $228. And what do you
$228.
think? And what does it cost the average dentist when they send an alginate to the lab to make an
So
appliance?
that's what I said. I know this because I used to do that. I said with the alginate and the assistant time and sending it off to the lab fees were about $195. Alginate, assistant time, all that good stuff. We figured we just wanted to offset those costs and just sell it for whatever it would cost them to do to the lab. Plus, you don't have to wait 5 weeks to get it.
But you got to make money on it. How do you make money? I mean,
We sell it for
We sell for
$228.
more. Yeah.
So we sell it to the dentist for $228, and they sell it to the patient for whatever it is they want to sell it.
But how do you make money? I mean, you have your cost lower than the $228.
Oh yes, you mean on the.
So you can make a profitable business just selling it for $228. Okay.
So
Yeah, that's great. And most dentists are, they already have their.
Because
night
most
guard
business
fees
models
set.
now they don't want the one-time sell, they want the subscription. So do you have an app that the
We
patient
do.
down?
Yeah.
And what's the
I'll
app called? Asesso Health?
show you. Asesso Health. Yeah.
Okay, so and the app's free,
That's just free with the purchase,
and
which
here are
is
the
one of the
metrics
great parts.
that come on that.
but you know what you should do?
Can I come to your site, Howard, so I can show you?
Yeah, absolutely. I took a bath 3 days ago, so I
Okay.
shouldn't be bad. But just
You're
real
right.
quick on the business model.
Yeah.
Because what you do is you set a price so low on a subscription, they're already paying $20 a month for Netflix. They're paying $10 a month for Spotify.
Yeah.
Why don't and you can't charge $1 a month for that
I'll
app?
tell you.
Because it doesn't sound like a lot of money with one person.
So Howard, I'll tell you
But
why.
at 100, 1,000, 10,000.
I'll tell you why. Initially, we want the data. That's why.
Oh, so then just say, okay.
Yeah.
So then you'll have your Netflix moment one day when you'll Spotify into the app.
Exactly.
And just start with $1 a month because that's what the government tell you. When they started federal taxes, it was 3%. Because they knew all they had to do is get their foot in the door.
Yeah.
And then you can just fly it to 4%, to 5%. Now they steal half your money.
Right.
So you just get your foot in the door with $1 a month on the subscription.
Right. So how it looks here. So what we're looking at is this is my grinding score from the last time I wore my sensor and my guard. So we do without the grind guards. So initially when somebody purchases it, they are going to wear the sensor on the side of their cheek, their masseter muscle without the guard. So that's going to give them their baseline.
3 nights.
3 nights. And then they start wearing the guard with the sensor. And then that's going to give them the difference. So it shows them how well it works. So you can see me here. It's a difference in the scores. And this is just the grind score. We have other things that we're monitoring as well. And so you go to my monthly and you can see when I'm not wearing my grind guard, how each day it's just getting worse and worse.
So the red dots are your
the
out drinking nights with the girls.
That's right.
You know what?
And the
Something
greens
like
when you're
that.
home with your husband and 2 boys.
Exactly. Something like that. Yeah.
20 tequila
Yeah.
shots.
Yeah.
Yeah.
And then we have muscle fatigue here. So same thing. It's showing you without versus with, and it has the little graph here. Same type of thing. It's really great. And then goes into your sleep efficiency. And this is where Dr. Cliff was talking, the tosses and turns, the awake time, and then just your overall sleep efficiency. So it's really cool. So they get all this data every morning when you wake up, you answer questions. Did you wear your grind guard? Did you drink alcohol?
Oh, really?
That's one of our questions.
Do you have stress?
Yeah,
Well,
and
that was going to be my next question, because I care mostly about everyone under 29. You know, if you're in your twos, that's the one I'm concerned about, because they're, you know, they look at guys like us and say, shut up. You're in the golden days. There were no DSOs, you know, and it's like, look, there's been a bad guy. There's always, when we went through HMOs and capitations, and now they're just not happy. They're mad at the ADA. They're mad at Delta. They're mad at everybody. So I call it just blame everything on your mom. That's what all people do anyway. They just blame everything on their mom. I call this the mom period. But the next thing with that young girl that just graduated middle school 2 years ago, and I was to ask you about different camps. Some people think this is all psychological, and there are a lot of dentists that believe that, and they believe that it's more common in women because they sexistly say, on social media, I know it's just crazy women. That's all it is. And it's like,
I'm gonna go with because women are so stressed out.
yeah. So I want to ask you, how much of because we've heard other camps say like the 5 major spasms with Sapiens is brain spasm, headache, jaw spasm, TMJ, lower back pain, the whole chiropractic industry, irritable bowel syndrome, which I assume Courtney has because I keep hearing all these weird noises, and or heart, angina. So those are the 5 spasms, and there are some dentists that think, well, if it is psychographic, I'd rather have TMJ. I don't want to have migraine headaches. Those are paralyzing. I don't want to have a heart attack. I don't want to be passing gas all day long in the workspace like Jerry does. So how much of this is psychographic stress response to spasms, response to stress, and how much is biomechanics?
Yeah. So you can imagine with stress, you're going to grind more. That's all there is to it. When I talk to my patients all the time, I usually will ask them, maybe you have a little bit more stress going on right now. And immediately they'll be shaking. I'm taking care of, my parents, they're not doing well, or, my husband just died,
husband died.
Or,
it's never the husband.
I'm moving,
it's the wife.
I'm getting divorced, or, kids, I'm studying in college for exams all the time. I'm just stressed out. Inherently, and stress is manifested many different ways. You can say stress is also physical, like, you ran a marathon, or you went to the gym and you worked out for 2 hours, and maybe you were clenching when you were working out. So, it could be physiological or it could be mental, and it just exacerbates the grinding and the
because stress is just a change. You can have us, which is good. Like, I'm getting married in a month. Could be distress bad. Like, you're getting married in a month.
I'm also going to say that it doesn't discriminate. It doesn't discriminate against men, and it doesn't discriminate against women. And it's a pervasive issue and a big problem. And so it really just hasn't been addressed. And so I just really wanted to address it. Yeah.
Yeah. That is amazing. And I will go back. I'm going back to that girl just graduated 2 years ago. Yeah. The orthodontists are telling her that if you got TMJ, what you do is you send them to the orthodontist. They put your jaw where it needs to be, and then they pull all the teeth there, so your jaw will be perfect. Then there's the other half of the dentists think that the orthodontists screw everything up because they blow out the curve of speed, the curve of Wilson, they straighten everything out. They're just this aesthetic thing, and the joints in a different place. So. And seriously, I've been addicted to Dental Town since 1998, and that thing's got 10 million posts. So a huge portion of dentists think that the orthodontist send them to the orthodontist, they'll put it and they'll do it right. And the other half say, "Oh my God, they're gonna blow up, they're gonna ruin everything." Where do you sit on
You
that?
know what? You can say it can be treated in multiple ways, actually. You can go to the orthodontist and they can extrude the teeth down, and move them up, from, creating that freeway space, that natural opening of the jaw. You can do it that way. You can do full crown and bridge, but then you got to make the teeth a little bit longer to get them in that relaxed position. But you're never going to recapture that disc in its natural state. If they've had some type of traumatic incident, it's just not going to happen. They're going to live with that all of their life. So I just kind of think that this is a very conservative approach. And you give this to the patient, you can monitor it. There's a proximity sensor to see if they're actually engaging with it. You can follow up, because to date, we just give them an acrylic, night guard and send them on their way, and they don't comply with it. They just don't like to wear those big bulky night guards to begin with. But you get to this point right now, and this is just very conservative, right? I mean, you don't have to go to the orthodontist and spend 2 years, bringing down teeth, or, I know there's a lot of people that are doing the equilibration, you're shaving teeth here or there, or, hey, let's just shave this tooth down. Well, it doesn't discriminate. It's just going to move to the other tooth because you're still grinding at night. So it was just an issue.
Well, that was my next question. Why do so many traditional night guards fail patients in real world use?
Yeah. So a lot of people are wearing these aligner trays. Maybe they open your bite up by about 1 millimeter. It's not enough, right? It's just not enough. They don't open the bite between 7 and 10 millimeters. Our patented slope design opens you up the perfect amount.
And by making it in the mouth,
Yeah.
I mean, talk about the perfect articulator for this patient,
Yeah. And the other thing is, you really want to minimize those clenching forces, right? Because as the forces of mastication can be anywhere from like 5,000 to 10,000 pounds per square inch, those real hard clenching forces. And, you wonder why people are cracking their teeth all the time, or splitting their teeth and needing to go in to have root canals. Not only do we just worry about protecting the teeth, but we really want to just focus on this being a muscle problem, and we want to address the muscles is what we really want.
Okay, but I really want to ask this question, because you are an endodontist and you are a TMJ.
Yeah.
You call yourself a TMJ specialist?
I don't.
Because what is the specialty for that?
I'm an endodontist. Very proud.
Yeah, but what?
Let's just say somebody's grinding their teeth. They come in, they think they need a root canal. We do all of the tests on the tooth. It's a little cold sensitive, but there's no filling, there's no crack. We're looking under the microscope, CBCT, whatever you want to do to make an accurate diagnosis. All you have to do is take your finger right here, you put it in there and
Put it inside the mouth or
inside
extra?
the mouth, and touch up right above the third molar, and you can actually bring somebody down to their knees. You'll actually.
And that happened to you
Oh yeah.
for the diet. But what if you did that right now? That you're wearing
My appliance. No, it's much less.
it's much less.
Mhm, much less.
And who causes more pain? TMJ, your husband, or your two sons? I want them
He is
in
my
ranking order
husband.
from worst to.
I'll tell you. Let me just tell you something super unique about Courtney. I had her read something for me one time. This is during the daytime. So she was reading whatever it is she was reading on a piece of paper, and she was grinding her teeth while she was reading the paper. And I'm like, I could see her masseter muscle just working. I go, do you know that you're actually grinding right now? She's like, I am.
And I'm a huge reader.
A lot of times you can imagine, hey, if you're stressed out, maybe driving your car, or you're doing a workout and you're clenching, and the cortisol that's being released, because of stress of you clenching down, whatever it is. It's not just a nighttime thing, but subconsciously while you're sleeping, you do it at nighttime, right? But many people do it during the day. You're heavy, crane operator, or heavy equipment operator, or you drive a semi. The grinding doesn't really just happen at nighttime. It happens during the daytime as well.
Well, I can't believe the hour went away, but I want to. Your website is Asesso Health, so just take assessment. So ASESSO Health. And I always think of the word assumptions. I love that word because my instructor used to say assumptions. Remember, it starts with ASS because every one of them falls out of your ass
Yeah.
and it has nothing to do with anything. It's just an opinion piece.
Well,
Don't tell me about your assumptions. You
I
know.
had to be careful with the ASS. It was just ASESS.
So,
but I tell you and I don't know if we talked about this off air or on camera, but Asesso, we talked about me being Greek, and Asesso was a Greek goddess of healing. So that's where we just played off of that.
yeah, and when he came in here, I told him I had a rash, and he pulled out Windex and started spraying Windex on me. I said, "Get out of here, you Greek! You can't cure everything with Windex." But have you ever cleaned yours with Windex? I just want to know the truth.
Not yet.
Then you're only half Greek.
Yeah,
you're only half
I
Greek.
am only half Greek.
So my final question: if you could change one thing about how dentists approach TMJ and bruxism tomorrow, what would it be?
Know that 75% of your patients that walk in through your door on a daily basis have TMD. And you know what? If you care about your patients, I think you should do a comprehensive TMD evaluation. Super easy. It'll take you less than a minute. Be thoughtful and ask the questions. Do you suffer from headaches, migraines, poor sleep, tinnitus, any type of jaw pain, because people are going in and getting Botox injections in their masseter muscle. Well, that's great. You paralyze the inferior head of the masseter muscle. What are you doing about the temporalis? What are you doing about the pterygoid muscles, or the digastrics and stuff that actually open the mouth, the myohyoid, geniohyoid, muscles. So
everyone accuses me of having all this Botox. I want to tell you, this is all natural.
well,
I'm not even wearing a wig.
You look good.
My God, they're like, you got. So my advice to just like Ben Johnson to you is, those kids that are dentists in their twos, they're going to need a thorough course. Our director of online continuing education is Nareg Apolinian. I don't know how you pronounce that. I always call him Nareg. DMD. He's in Canada, but I'd put a very detailed course, and I would make it an hour long. And if you need 2 hours, 3 hours, make it a 3-part series because they only watch an hour blocks. And by the way, kids out there, I got more free courses on Dental Town than you could ever find, and we got because some dentists just want the reach, so they put them up for free. Some people, it's their job, so they want to economic bear. But I remember like some of them, like my friend, the oral surgeon Jay, every time he puts a course on there for free, he gets 10,000 views, and every time he charges like $38, it drops all the way down to maybe 1,000. And it's like, you're an oral surgeon, you really need that $38?
Right.
I would just put it up there for free, but that's something you can decide. But
that'd be fantastic.
yeah, I just think that's great, and I'm just thinking.
Yeah, well, like I said, we're dipping our big toe in the water right now. We're just starting to launch. We wanted to launch in our area. This is my second podcast. I just did a podcast at the Chicago Midwinter meeting a couple weeks back.
With the AGD or who was?
I did it with Dennis in the Know.
Oh, right on! I love that show.
Yeah.
And
great people. Yeah.
And so my second to the last question is, you're an orthodontist. I mean, an endodontist,
right,
and you're doing TMD stuff.
Yeah.
There was an orthodontist in Arkansas who hired hygienists because instead of sending to the patient the general dentist referral, and then they take off they take off the brackets, then they send it to your office to do the cleaning, and then you come. How stupid! I mean, it's like the orthodontist thought, the best time to clean their flipping teeth is when they're getting so you hired hygienists, and it just made so much sense. And then some kids who didn't want ortho and their mom forced it on them, they're not taking care of their teeth. They're not where they come in. There's Cheetos and Oreos in all their teeth. And I swear to God, Arkansas, I mean, it was like Lucifer got a dental license and they lost their flipping mind. And I'm always patient first. It's like I'm family first, business second, and I'm consumer first, not dentist first. And it seems like so many rules is like the ADA. It's like their pack. It's like some of those rules are so pro dentist. It's like I'm embarrassed on behalf of my patients to be contributing to this pack to saying this bullshit. So I literally tell the homies, lighten the hell up. I mean, I don't think the dentistry needs to go the way of the Teamsters. You know what I mean? And I'm glad that you're doing non-endodontic work. And I wish all orthodontists would have a hygienist. I mean, what other when a kid comes in, his braces are filled with Cheez-Its.
Yeah.
I think we need to, instead of giving you a lecture and trying to make you feel bad and shameful, why don't we send you over to the hygienist and get your damn teeth cleaned, and she can go over the home care instructions real good. And that's a big reason some of these orthodontists are loving Invisalign, because when you got little Billy, it's kind of nice to be able to take that thing out and get all the peanut butter and jelly off and then put it back in. But so on that note, they can look forward to an upcoming course on Dental Town about all this.
100%.
All right, man. Thank you so much for coming on the show. It was an honor to have you on the program.
Thank you so much.